Hi everybody, I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. And tonight, by special request, we are still working on my camera angle. I just got back from a walk, and we are talking about the Virgin Diet. So if you've never heard of this, JJ Virgin is an author. She has a really great backstory about how, unfortunately, one of her sons was critically injured, and she, obviously did what any mother would do and tried to get him the best care, and found out that, or obviously knew what they were serving him in the hospital was not going to help him heal. So she actually obviously tried to get him out of the hospital ASAP, but also while he was in the hospital, provided all of his meals, which is kind of an interesting story. So if you're not familiar with that, you might want to look her up. But the Virgin Diet is actually her book, and it is nothing from a functional medicine standpoint that groundbreaking. It is actually a modified elimination diet, but it is a very good book in the sense that if you are looking to address some of your food sensitivity issues on your own, without the guidance or without the support of a practitioner, this book is very simple and very easy to follow. So it talks about the 8 most inflammatory foods, which are dairy, soy, gluten, corn, sugar, artificial sweeteners, and peanuts. So over the course of this book, essentially what she has you do is eliminate those foods and then slowly add them back in so that you are able to recognize if you experience any symptomatology from said foods, which of course is what an elimination diet is anyway. Now, obviously from a functional medicine standpoint, when I do this with a patient, it is much more organized. I'm actually on the lookout for symptoms as well, because oftentimes patients don't recognize what a food sensitivity is, what a food sensitivity symptom is, because it is very different than a food allergy. So a food allergy is an instant reaction. It's sort of, if you eat shrimp and your throat closes, that's a food allergy. Now, food sensitivity can be anything from skin blemish, a breakout, inflammation, swelling in the belly, abdominal cramping, constipation, diarrhea, to things that you may not recognize, such as mood instability, difficulty sleeping, joint pain, some other relatively benign symptoms that honestly could be attributed to other things, but in reality they are due to a food sensitivity. So in our office, I give patients one of 2 options. If I feel that food, if I feel that an elimination diet is a good place to start for someone, I will offer the diet or I will offer food sensitivity testing. And the reason to go with one or the other varies for some people. Obviously, if you're doing testing, you're paying for that. That is a test out of pocket. It is not covered by insurance. It is a blood spot, so it is not a serum test where they're going to take a vial of blood. It's literally a blood spot. It can be completed at home. I had my husband do one last week. All you do is literally prick your finger, and essentially, and this may sound a little bit morbid, but you color in 4 little circles with blood, and then they test that dried blood to see if there are any antigens present when they're exposed to these different allergens. And if that doesn't bother you, the testing, if you have the money for the testing, obviously it's quick, it's easy, but you have to pay for it. But you have an answer in anywhere from 10 days to 2 weeks. What's also interesting is that when you're running a food sensitivity panel, if the results come back and let's say that you're being tested for 20 foods and you show up sensitive to all 20 foods, in reality, you're not sensitive to 20 foods, you have leaky gut, which is a whole nother talk. But on the flip side of that, if you don't have the money, if you don't want your blood, if you don't want to color in little blood spots, then your alternative is participating in a elimination diet, which can be quite drawn out. If I remember correctly, the virgin diet is a solid 3 weeks of eating none of those inflammatory foods, which again are sugar, dairy, gluten, corn, soy, artificial sweeteners, and peanuts and eggs. Actually, so there's 8. I forgot eggs the first time around. So literally you're eating none of those things for 3 weeks. I have a hard time as a practitioner sometimes getting people to cut out one of those, but if you're hardcore and you can cut out all 8 of them for 3 weeks, then yes, the virgin diet may be for you. And then you slowly start adding those things in and keeping track of how you feel and changes in how you feel. And unfortunately, those can be very minuscule. And again, from a functional medicine standpoint, you don't necessarily notice inflammation going up until you've reached a tipping point. So there may be inflammation being caused by those foods. And if it doesn't trigger an outward symptom, you may not notice. So you could have a whole bunch of inflammation, but if it doesn't cause diarrhea, you're not going to record it. Or if it doesn't make you snap at your spouse, you're not going to record it. And in reality, there could be an underlying issue there. So that's why if it's feasible for a patient, of course, I always recommend testing. But obviously, elimination diets are very popular to determine what, if any, food sensitivities that you have. So that may be something that you want to check out. Again, the virgin diet, it's an easy read. We used to have a couple copies at the office and let patients check them out, but I do not know if they have been returned. So I would not say that I have them on file. My last recommendation would be following a very easy meal plan, which I have put up. I'll put the link above. It's a free download. You can go to drleasure.com and download this, give it a try. It does not include any of the inflammatory foods. Again, this is not meant to be an elimination diet. It's simply to give you a clean way of eating and see that eating without these inflammatory foods can actually be easy, can actually be manageable. So check that out and let me know how that goes. For the rest of the week, if you saw yesterday's video, we do have a couple things in the hopper. My friend Christy and I are going to work on putting together a Zoom meeting so we can kind of discuss stressors in the world right now and some recommendations on what we would suggest. And again, it's going to be a little bit of a different dialogue since it's going to be a Zoom meeting. It's going to be more of a, a mutual chat rather than a lecture on my end. I also had a request to discuss suicide as a chronic condition, which is obviously a very serious topic. So I'm going to do it a little bit earlier in the evening. So stay tuned for those invites. And then there's also going to be a third invite to more of an intimate evening with me to discuss our stress workshop that we have coming up and working with me individually on your stress. So if you've enjoyed the information that we've provided, if you feel like you've learned something and you want to be more critical in your implementation, then stay tuned for that. So I hope you guys have a great night. I am off to try and get Mr. P to sleep. And fingers crossed that that's an easy task. He had a nice day in the splash pad. So win for Amazon purchase, $15 splash pad. Since pools are sold out all over Chicagoland, I had to go with the splash pad, but it worked. And toddlers are pretty easy to make happy, so that worked out well. He did complain about the cold water, however. So we had to talk about how plants have to drink cold water just like we do. They don't drink hot water. So that's why, unfortunately, the water was a little chilly. So thank you for indulging me. Have a beautiful evening. Stay tuned. Tomorrow's video is going to be earlier. I actually have a date. I have a reservation to eat outside. So thank you to the restaurants opening up. Also, if you have not bought your $10 raffle ticket to support Main Street Libertyville, please do that as well. Please share that post. Do what you can to keep the businesses going in downtown Libertyville. There's a lot going on in the world right now. Things are super duper heavy, And if you've got a little bit of change left in your couch cushions, we ask that you help us support downtown Libertyville. Love you all. Happy Tuesday. I will see you tomorrow.